New year, new me. While others pop fireworks for the new year, you are popping your pimples? Stop. Now that's it, gotta go. Everybody wants that glow up to be the best version of themselves. And one of your goals might be having a clear skin. But what if you have that stubborn bumps or spots that just wouldn't go away? Do you have to go through all that skincare steps to achieve that glass skin everyone's talking about? Today, let's talk about a huge issue that we still get a lot of questions and concerns about: acne. Hey guys! Welcome back to the Good Doctor, and it's me again, Dr. Babes. So before we proceed with our discussion in Skincare 101, I'd like you to know that first of all, you're totally normal if you have acne. No matter how old you are, no matter your gender, and no matter where on your body it shows up. If you're struggling with acne, you are not alone. And in fact, acne affects an estimated 85 to 90% of people around the world and at some point in their lives. I'm actually experiencing acne right now, and I know that we absolutely 100% hate it. And if you're one of those 10 to 15% who had never experienced acne, what are you even doing here? Bring your clear skin somewhere else.
Emotional, damn it!
Just kidding. So today, let's talk about acne and go through everything we can do to treat it, from lifestyle and over-the-counter options, all the way through the prescription creams and even tablets. Now, that's a lot of information to digest, so we'll be making a two-part video, so you make sure to check them out as well. But I'll try my best to break it down simply for you before you might want start to break down. So, without further ado, let's get right into it. Blemishes, spots, pimples, bumps. There are so many words that we can use when it comes to acne. To understand acne treatments, first, you have to have at least a basic understanding of what acne is, what causes it, because then you understand how to treat it and you won't fall for any skincare tricks and trends. Your skin has oil glands in it, and the highest concentration of these are on the face, chest, and shoulders, and at the back. These are also known as sebaceous glands, and they secrete oil that travels up the hair follicles and out through your pores, onto the base of the hair shaft. And this then travels all the way to the surface of the skin. The purpose of this is so that your skin remains nice and hydrated and prevented from drying out, so that barrier remains intact. Your hair follicles routinely shed dead skin cells, which sebum carries out of your body. But acne occurs when there is a blockage or clog of that hair shaft due to excess oil production, and dead skin cells stick together, which results into the buildup of oil and fatty acids underneath the surface of the skin, resulting in blemishes. There are various types of acne depending on how deep and how inflamed your acne is. It can be inflammatory or non-inflammatory. Non-inflammatory acne is also known as comedonal acne, meaning it shows up as those little bumps topped with a white head or black head. Now, if the top of that blockage is closed, then you get what is known as a closed comedone or a white head. But if that blockage is open to the air, then those oily secretions become oxidized in a reaction with the air, and then they turn dark, giving you blackheads. It's the most mild form of acne, and it usually isn't painful. Now, people love those super satisfying pore strips that show all the gunk you've pulled out from your pores. And these work by temporarily removing maybe some of the debris of the top layer of your skin and that oxidized oil and dirt that comes with it. This may remove blackheads and whiteheads, but it could also remove important oils from your skin, which can lead to further irritation and dryness. So it's not going to help you with acne in the long run. And in fact, it could make your skin worse if you don't moisturize afterwards. Now let's go back. Once you have this blockage underneath the surface of the skin, a specific bacteria known as Propionibacterium acnes gets involved and causes a lot of inflammation. Which leads us to the second type of acne, which is the inflammatory type, which is a bit harder to treat. Pustules, commonly called pimples, form when the wall of the pore breaks down and they fill with pus. These usually appear red, swollen, and often have a yellow or whitish head on top of them. Sometimes painful and definitely can scar you, especially when you pick it. And if that inflammation is severe and it is at a deep level, then you can get a nodular or cystic acne. And if these cysts rupture, then you can get a long-term scarring and pigmentation.
Please. Think about it overnight.
And so, do not poke, pop, scrape, pick, or otherwise manipulate your acne, because touching it will only make it worse. And you can leave a permanent scar or start an infection, none of which you want, right? So what about hormonal acne? Hormonal changes, particularly a rise in testosterone, can lead to sebum overproduction, which is why acne often occurs during the teenage years or puberty, because this is the time your oil glands are active. However, it can also occur at any age, especially in women, when it's their time of the month. You know what I mean? Other factors contributing to the development of acne are bacteria, certain medications, and of course, genetics. So in summary, the pathway is oil glands secrete an oily secretion, and then you get the blockage of the hair shaft, bacteria gets involved and multiplies, and you then have an inflammation. We'll keep referring back to this pathway throughout this video so that you know exactly where each treatment has its effects. So let's start with lifestyle. And I'm intentionally focusing on this first because I think too often other doctors just jump straight out to prescriptions rather than talking about lifestyle interventions that can actually help. But which of these interventions have real evidence that they can help with acne? Let's start with diet. And there are certain foods that have a clear connection with causing acne flares. These include whey protein, skimmed milk, and concentrated sugars. And beyond this, even if there's no clear scientific proof of certain foods causing acne flares, you probably know for a fact that there are certain types of food that even if you just think about them, you get an acne breakout. And for me, that's dairy. See? Just saying the word gave me a new spot right here. Good news is, chocolate is not one of them. Now let's proceed to the next one. Stress. When it comes to lifestyle, stress worsens every kind of skincare condition, whether that's eczema, psoriasis, or in this case, acne. This is why you tend to have acne flares around exam time or just when a big event is coming up. Way to go to steal the spotlight, yeah? Now next is smoking. Now the exact mechanism is unknown, but the best theory at the moment is that it has an impact on the type of oil that your skin produces, making it slightly more sticky. And next is poor sleep. Increasingly, we're starting to become aware of the fact that having bad sleep increases the amount of stress hormones in your body, and that then worsens your acne. So with all that being said, the lifestyle interventions that you can implement to improve your acne is to make sure that you avoid those foods we talk about and to not smoke and make sure you're getting a good night's sleep, and also to reduce your stress levels. Well, these are just some of the things that we can modify, and I can't tell you not to be stressed, but just so you know, it does worsen acne. Now, let's talk about the over-the-counter treatments. And there are truly tens, if not hundreds or thousands of different creams available over the counter targeting acne. But rather than focusing on specific brands, because there's so much variation throughout the world, let's talk about ingredients. And actually, there's only a handful that have compelling evidence of being helpful. So let's start with salicylic acid. And this is truly one of the OGs of acne treatment. But salicylic acid is also in a ton of other cleansers and creams, and it belongs to an overall category of ingredients known as BHAs, or beta-hydroxy acids. It works by softening keratin, which is the main protein in skin cells, and it can also dissolve sebum, which is an oily secretion of the skin. So you can imagine the blocked pores on your skin, kind of like blocked drains, and think of salicylic acid as a drain buster that goes down there and slowly dissolves all of the gunk to make sure that we don't get that inflammation. Next up, let's talk about benzoyl peroxide. And this works in 3 main ways. The first of these is that it directly kills P. acnes, or the acne-causing bacteria. If you reduce the amount of P. acnes on the skin, that means that there's a less of it around to cause inflammation and bad acne flares. Benzoyl peroxide also has exfoliating qualities similar to salicylic acid, which we just spoke about, and it dries out the excess oil. And finally, it can directly reduce inflammation. This is why benzoyl peroxide is also really popular as a spot treatment, because it can turn down the volume of those angry red bumps. But be warned, this ingredient can feel very harsh on the skin. Over-the-counter options of benzoyl peroxide come in 2.5, 5, and 10%. But I personally would never go near 10% when it comes to the face. That's really designed for use on the body for things like acne or the acne on the back. Next, let's move on to retinoids. Now, retinoids are the family of vitamin A-related chemicals, and they are the single best ingredient in the entire world of skincare. They have a bunch of different benefits, including anti-pigmentation, anti-aging, and even anti-cancer. But for the sake of this video, we're going to focus on their anti-acne effects. Within the family of retinoids, there are over-the-counter and prescription options. The over-the-counter options contain retinol esters, retinol, retinaldehyde, or adapalene. Now, just because they're not prescription strength, doesn't mean that these ingredients don't work. And I actually always tell people that if you've never used a retinoid before, you should always start with an over-the-counter option, because you're going to risk the side effects if you're going straight to prescription strength retinoid. Retinoids work across the entire acne pathway that we spoke about earlier. They reduce the size of your oil glands, and they also make sure that the oil secretions are less thick and sticky. And they exfoliate to make sure that there's no blocked pores. They also kill P. acnes, the bacteria that causes the acne. And they are directly anti-inflammatory. I mean, come on, what more do you want? But the main issue with the topical retinoids is that they can feel harsh on your skin, especially when you start first using them. Okay, so let's wrap up with some quick-fire and notable ingredients as our runner-ups. AHAs, or alpha-hydroxy acids, are things like glycolic acid, lactic acid, and mandelic acid. And these are gentle exfoliants that help to remove dead skin cells and unblock your pores. They also reduce inflammation and stimulate the growth of new, smoother skin. Azelaic acid is another ingredient that kills bacteria. It is also anti-inflammatory, and it also exfoliates. And finally, niacinamide reduces the amount of oil secretions from sebaceous glands and is also anti-inflammatory. Well, those are the notable ingredients that you have to check when buying or using your products. Overall, non-inflammatory acne is pretty treatable using over-the-counter topical products. It will take a few weeks to start really seeing a difference, so be patient when you're trying new products. And if you don't see a change after 6 weeks, maybe try a new product, or better yet, ask a board-certified dermatologist. We'll bring our discussion more about acne to the next level, which involves prescription medications and tablets on our next video. So make sure to stay tuned, and I'll see you on part 2.
To proceed with free online consultation, click the link in the comment section.